Hey y'all, welcome back to Movement Link. So I want to spend a few minutes talking about something that is super common for people to struggle with at least at some point in their life, and it's having this low back pain that tends to be low and on one side. And a lot of times this low back pain is just caused by your pelvis being out of whack. And what happens is when we spend prolonged periods of time sitting down or standing, traveling, maybe we're at a show, and we're sitting in an awkward chair, or we spend just a Netflix day, a lot of times we hang out in these positions and then we can get stuck in these positions, and that pelvis can literally get rotated and just kind of stuck there. So then as you're trying to move and hinge, you can just see the thumbs would be kind of where those things meet in the back. We can get out of line, and then that can show up as pain on one side. What we can do is, if we're imagining that hip, this is the back, the fingers would be the front, is when we're out of whack there in the back, we're also going to be out of whack there in the front. So the quickest way that you can check on it is just find the top of your hip bones. And what I like to do is I just like to get in front of a mirror. I like to get everything nice and tight, belly button drawn in, squeeze my butt cheeks, kegel, and I find the tip, just those pointy parts of your hips, right there, and just kind of put my thumbs on them, and then I'm just looking in the mirror, and I'm looking for, is one thumb way up in the air, or are they mostly, or not, do they look flat and in a line? And what we'll see is a lot of times those people are having low pain on one side, that opposite front hip is jammed up in the air, and when you put your fingers there and you feel the bones, it looks something like that. So these drills are the quick and easy way to fix it. So what you're going to need is a foam roller, or you don't really need a foam roller. We're not going to smash or do anything like that. You just need something to drive your knees into at the back end of these exercises. And so a pillow, a ball, anything like that will work. But foam roller works great, something people typically have as their toolbox. So I'm going to hit the ground and we'll get into it. All right, y'all, so this is very simple and you can follow right along. Doesn't take very long, pretty easy to remember. We're gonna do 5 sets, 3 seconds on each side. So it's gonna be a total of 10 3-second kind of push-pull. So what we're gonna do is we're gonna lay down on your back. You're gonna lift your knees up, and you want your knees to be just about 90 degrees. We can get away with, the angle's not exactly, doesn't matter exactly, but being at that 90-degree angle tends to help the most. We're gonna take one hand and put it on the other side of your leg, and that arm is gonna pull that knee towards you. We're gonna take the other hand and put it here, and that hand is gonna push that leg towards you. But your goal is to not let your legs go anywhere. So we're gonna brace. So belly button drawn in, we're lifting those legs up. One here, we're push, pull, and bracing. 1, 2, 3, relax. Switch. So now I'm gonna pull with the other one, push with the other one. Draw your belly button in, resist, push, 1, 2, 3, there we go. That's one set. We're gonna do 5 of them. So let's go back. 1, 2, 3, switch. 1, 2, 3, switch. I like to kind of start slow and then almost get like almost max efforts in here. So that's just 2 rounds. We'll do 3 more. 1, 2, 3, switch. 1, 2, 3, switch. The other thing to notice is as we're doing this, do you feel that your low back, do we feel like those bones right there on your hips, are those both on the ground? And you probably feel one kind of wonked up in the air. So let's go back to it. Feel that evenness on the ground. Push, pull, resist. 1, 2, 3. Switch to the other side. 1, 2, 3. There we go. We'll do one more. 1, 2, 3. Good. 1, 2, 3. So really all this is doing is that push and pull motion, and the resisting is just taking that pelvis and it's slowly getting it back to be right in the middle. Then we can add some movement here to try and push those hips back in the right spot. So all we're gonna do is we're gonna squeeze with our knees in, grip in that foam roller, and then we're gonna lift up and squeeze your butt cheeks. So we're just going up real high, squeezing in, and we're just gonna come down. Sometimes you'll hear like a clunk, and that's that hip just going back in place, but you're not doing anything wrong if you don't hear a clunk. So push in, lift up. Good, and then you can move those feet, work them into a comfortable position so you can push in, drive up the butt cheeks, squeezed, come back down. We'll do a couple more. Draw the belly button in, come up, squeeze the butt cheeks, push in on the roller, and then one last one. There we go. So we always like to test, retest. So we were testing where that hip is. You probably are bending over, squatting, doing some things. You kind of know where that's painful. So now is where we would retest that hip. We would squat, bend over, do those things. See, feels better, same, worse. This is something you can repeat multiple times. For some people, we get it fixed one go. For most people, we make progress, a lot of progress in a go, and then we want to check in on it and do it a few times for a few days just to make sure that hip is really in place. What can we do in the future to prevent this wonkiness? Make sure we're not spending prolonged periods of time doing weird things as we watch TV. When we have those bouts of, oh, we're sitting down for 3 hours at a concert or a play or whatever it might be, make sure that we're doing these things to counterbalance it. Sometimes, I don't know, maybe once a month I'm warming up. If something just feels a little off, I go straight to it. Most of the time it feels better kind of right away. The other things we can do is while we're working out, draw in, Kegel, squeeze those butt cheeks, learn to create that stability through the pelvis so it's just not going wherever it wants to go. Hope this helps. Talk to y'all soon.